Okay, now we're going to look at autism spectrum disorder. If I can move the mouse. Autism spectrum disorder, by definition, will impact both a person's communication skills and their social skills. The degree to which these skills are impacted varies with each individual. ASD falls under the greater umbrella of pervasive developmental disorder, along with Rett syndrome and childhood disintegrative disorder. We will not be looking in Rett syndrome and childhood disintegrative disorder for the purpose of this course. Instead, we're going to look at the disorders included in ASD, which are autism, Asperger's syndrome, and pervasive developmental disorder not otherwise specified. Autism is sometimes referred to as classical autism. Individuals who are diagnosed with autism will experience the most severe symptoms of individuals with autism spectrum disorder in general. They may have concomitant intellectual disability, and this will impact the degree to which verbal language is achievable. Generally, the lower the cognitive skills, the less likely someone is to develop really functional verbal language. But your cognitive skills, as measured on an intelligence test, would have to be quite low to not be able to do that. People with autism are more likely to have overt stereotypical behaviors such as hand flapping, wiggling their fingers in front of their face, spinning, things like that. However, some individuals with high-functioning autism can be difficult to distinguish from Asperger's syndrome. Asperger's syndrome, individuals generally have average or above average intellectual skills. They are verbal and their vocabularies are average or above average, and their grammar is generally very good. They have poor ability to read facial expressions, tone of voice, or to understand figurative language. They're not going to understand sarcasm in general. In general, they won't understand jokes or similes or metaphors or even things like puns. And people with Asperger's tend to be very literal. There is some debate as to how to differentiate between Asperger's syndrome and high-functioning autism. And then finally, we have pervasive developmental disability not otherwise specified, or PDD-NOS. Individuals with PDD-NOS demonstrate enough characteristics of ASD to be placed on the spectrum, but they don't fit neatly into either of the other categories. They might not demonstrate some of the stereotypical behaviors, but they might demonstrate the social difficulties and the language difficulties, or they may demonstrate all of the characteristics, but they may demonstrate them to a very mild degree. So let's look at some of the communication characteristics. The first thing we're going to notice is deviant patterns of language development. In many disabilities, such as Down syndrome, language development is delayed, but it will follow a typical progression. In children with ASD, we'll see some atypical patterns, including echolalia. And echolalia is the verbatim repetition of words or phrases. It can occur immediately following the word or phrase heard, or it can be delayed. For example, I worked with a little boy who frequently quoted from Mickey Mouse Clubhouse during therapy sessions. And he would call, "Oh Toodles, oh Toodles," over and over again. And while young children generally imitate and use imitation as a tool for learning to communicate, echolalia is done without communicative intent. It's often used as a method of self-soothing or of stimming, or when someone does not know what is expected of them, but they know they're expected to say something. So if a child gets nervous, that might be when he starts calling for Toodles. Or if they know that they're supposed to take a conversational turn, but don't know exactly what to say, they might fall back on a phrase that they repeat over and over again. The next thing that we're going to see is restricted use of language in early development. Typically, developing children tend to use language for three general categories. There are more, but in general, they're going to use language to request, so to ask for something that they need, to protest, which anybody who's seen a 2-year-old knows that they're going to say no, or to comment things on their environment. Children with ASD tend to limit themselves to naming objects in their environment. And while a typically developing child might name an object to share it with a communication partner, for example, they might point to the moon in the sky and say moon because they want that person to look at it. Um, that aspect of the naming is often absent in children with ASD. They're just going to name whatever they see and keep it kind of to themselves without really looking to share that with someone else. And then the other thing that we're going to see is splinter skills. Children with ASD may demonstrate some skills way above their age or developmental level without acquiring the more basic skill first, and that will leave holes in their development. For example, a 3-year-old might be sounding out words without really knowing what those words mean. They might be reading The Cat in the Hat without having a good understanding of what a cat is um, that a younger child would know. So in addition to deviant patterns, their understanding and expression often also will be just plain delayed as well. You're going to have the possibility of limited to no verbal skills. Research indicates that 24 to 40% of children diagnosed with autism will remain nonverbal throughout their lives. This means that they may have some other form of communication system in place, including pictures, um, so that individuals can be taught to effectively use a picture system. And the one example is picture exchange communication system. To communicate, the individual would select a picture and bring it to a communication partner. They can combine several pictures to create a sentence, and this will often facilitate verbal language. Um, they might use some sign language, or they might use an AAC device. The next thing that we're going to see is that social aspects of communication will be impacted. You're going to notice reduced eye contact. Um, Even if you really try and make eye contact, a lot of people on the autism spectrum will avoid it actively. You could try and get right in front of them and they will still look away. You could move right into their line of vision and they're going to do everything they can to avoid that eye contact. And that's not always the case, but it is often the case. You're going to notice restricted conversational topics. People with Asperger syndrome or high functioning autism often have a narrow range of topics about which they like to talk. They might know a lot about these topics and continually try to bring conversation back to them. Topics can be about just about anything. Geography, honeybees, trains and vehicles are popular with the littler kids, computers, video games, Legos, and television shows. Encouraging a different topic of conversation may be difficult, and remaining on a different topic of conversation may also be difficult. They want to get back to those things that they're comfortable talking about. People with autism spectrum disorder will have difficulty interpreting tone of voice and using tone of voice correctly, and they'll have difficulty with figurative language. But we do want to expect a great variability in skills from individual to individual. Communication skills will vary, and while it's helpful to have a working knowledge of how communication skills may impact it, it's also important to understand that there is a great variety in the communication abilities of people with autism spectrum disorder. All right, let's take a look at some of the strategies that are going to work best and how we can more effectively communicate with our client. These strategies are going to vary based on skills and abilities, but some key strategies that are important to remember are proximity. This one is really important. You want to stand within a few feet of your communication partner and make sure you're facing him or her. This is going to help reduce the distractions in the environment and will make sure your client has a clear view of your face. You want to maintain and encourage your communication partner to maintain eye contact. This way, they're able to pick up the cues that they are able to interpret when they can see your face. A lot of people with high functioning autism and Asperger's are taught which facial expressions to look for and what things they can look on the face, and they'll remember these things, but they really need to be encouraged to look at your face, and they really need to be encouraged to focus on you, and being close to them will help with this. You want to be clear and direct. Make sure you say what you mean. Give clear directions, avoid sarcasm in your conversation, and explain figurative language if necessary. The other thing you want to do is check frequently for understanding. So you can ask your client to repeat back to you what you've asked of them. You can ask them a question the response would indicate that they understood what you said. Um, and don't be afraid to respectfully steer your client back on topic if necessary. Going back to the figurative language, I was working with 3 or 4 children, and we were really having a lot of fun, and they were getting really silly. And we were talking about an upcoming trip to the zoo, and they were being so silly that I said that I was going to sell them to the monkeys. And 2 of the little boys thought that was really funny, and the one little boy with high functioning autism stopped laughing, and he looked at me in a very concerned voice, and he said, "You aren't really going to sell us to the monkeys, are you, Danielle?" And so then I had to explain the joke to him. So it's easy to forget that children and adults with high functioning autism and Asperger's can be very literal. Use of signs and gestures. Signs can be powerful in helping an individual to have their needs met. They're visual, and often people with autism spectrum disorder do better with visual information. And the other thing is they can be taught using hand-over-hand procedure. So you can actually help your client to use a pointing gesture as you're working with them to teach them that they can ask for things from you. You can use your hands to help them make the sign for a preferred activity. And then you can immediately reinforce that. If you're teaching them the sign for jump so that you can jump on the ball with them, then you can immediately jump on the ball. So that they have a way of telling you that they want to jump when they come into your room or into your session. Or you can do the same thing with swing. Teaching gestures and what they mean can be helpful. This little boy is using signs to make requests. He's also talking, but I think that the signs are probably what's facilitating that. And he wants more tickles.
Ready? Yeah, he is. I
There's one.
want tickles.
One more?
You want tickles?
He's showing her, he's using a gesture of showing where. He wants his belly tickled.
Tickles. Yay, all done.
Lucas. Hi.
You can see his eye contact.
Hi.
Hi.
Okay.
Hi.
So he's using signs to request an activity that he likes. Visual cues are going to be really powerful once again for individuals with autism spectrum disorder. Creating visual schedules is going to be big. They're going to allow the individual to predict what is coming up next, and they're going to give them a sense of security. For a patient in a hospital, this could be something as simple as writing on the whiteboard in the room what time breakfast comes, what time the rounding doctor will be in, when he or she may have visitors. If you have a patient who's in the hospital with autism spectrum disorder, that might provide a little bit of comfort to them since they're already not in their comfortable environment. For a child in an occupational therapy session, you may have pictures of the 3 activities you have planned for that day. You're going to want to use visual cues as a means of offering choices. Often clients with autism spectrum disorder have limited language, and they may already be familiar with using pictures as a way of offering choices, as a way of indicating a choice. So it's going to give them the way to indicate their want or need, and it's going to give them some control over what will happen. They can use the words, or they can point or reach for the desired choice. And once again, we want to keep in mind that continuum of difficulty is objects being the least difficult to understand and just plain text being the most difficult to understand. And it's not going anywhere else. Okay. This is an example of using a visual schedule.
This is 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 a visual schedule. This is also a visual schedule. A visual schedule is basically a calendar or anything used to communicate to people what to expect. Think about it. As adults, we all have schedules in every day of our lives. We all know where we're going. For example, from the time we wake up, we know that we have to eat and bathe and then go to work, come back from work, have dinner and then sleep. The point is, we all know what to expect. Likewise, our children also need to know what to expect. They may not have an understanding of time or a calendar, but they need to know what is going on. Hence, the reason why we often see behaviors and tantrums with children with autism is because we often bring them through different transitions without explaining to them in advance what is expected out of them. So, in short, a visual schedule helps to give these children with autism a sense of predictability of what is expected out of them. For today's how-to video, we are going to learn how to use a daily schedule. This is a weekly schedule board, which can also be used as a daily schedule. For example, with a visual schedule, when the child comes into school on Mondays, he will know that he will have a morning session with this teacher, and then lunch with this teacher, have lunch play with this teacher, an afternoon session with this teacher.
So you can see it's pictures and
before he goes
photographs,
home, he will have circle time.
and the child knows what they're going to do.
Over here, we have a child, Trisha, and I'm the therapist. Alright Trisha, today is Monday, let's check our schedule. First, we're gonna be with Rachel, and then lunch with Guy, and then lunch play with Rachel again.
So you could do this for something as simple as a half an hour session. Like I said, you could have your 3 activities, and the first thing you do is look at what you're going to do that day. Or if with a patient in the hospital, you have it up on their board and you say, okay, this is what we're doing today, and it will give them a sense of predictability and security. And then once again, technology. There are many, many cheap or free apps geared specifically toward individuals with autism spectrum disorder. And when we look at our autismspeaks.org website that we're going to look at in this lesson, they have several of them on there. Alternative and augmentative communication is also something that can be used with people with autism. Although now that we have iPads, $1,000 devices or many $1,000 devices are not typically the way people are going anymore. They're just getting iPads and downloading the apps for those. It's much cheaper, and it's much easier to test out. And if a particular app doesn't work for the client, then it's much easier to change it. And then once again, emailing and texting can be really good ways of communicating with your client instead of over the phone. Um, And that is it for this lecture. Please check out the websites and answer your discussion questions.